Hello and welcome back to video 5 of the series of staying healthy and preventing COVID-19 infection during the current crisis. It is indeed extremely worrying that the secondary infection has already begun in several countries. This is outside the primary infection they had and emerging different spots away from those previous areas and small and large outbreaks. So it is even more dangerous that some of these outbreaks are now starting within the hospital setup. The patients who are admitted and not properly quarantined or separated could easily infect number of other people within the wards as well as the hospital staff. Similarly, in the quarantine center, active patient can infect a lot of other fellow people in that quarantine center. Thirdly, the people who released too early from the quarantine centers without testing is another source of the secondary infection and the community outbreaks. So, in part, the latter is due to this faulty assumption that after day 14, everybody's good, nothing's going to happen. And as I mentioned in the previous video, the day 14 is an arbitrary setup and not based on hard science. So, failure to test prior to discharge from quarantine center can really cause a lot of havoc across the country and disseminate the disease way beyond the controllable areas. Whereas totally relying on the continuous curfews for weeks and months is another issue because it clearly is not going to prevent the disease happening elsewhere, but it continue to harm ordinary people while getting little benefit of eradicating the disease. So, if you look at the successfully controlled countries with COVID, for example, South Korea, Singapore, early enough they opened up outside hospital testing centers for normal people, you and I. So people can go there voluntarily and get them tested and take the appropriate precautions. That's the right thing to do. Unfortunately, in other countries, even hospital patients or the quarantine patients are not tested, which is another disaster asking for trouble. So, effective testing is a key way to flatten the peaks of outbreaks. In absence, virtually it's impossible and cannot predict where next outbreak is going to occur. So, effective actions through testing and taking the appropriate action will clearly reduce the incidence of infection. That is same as the flattening of the peaks of infection. It's also reduce the need of hospitals, ICU beds, and indeed reduce the deaths. So it also give a break for the desperately hard-working hospital staff and the law enforcement agencies so that they can relax and recover from their own stresses. So this is the model the other countries should adapt quickly rather than waiting later as they did in January and February. So the answer to the current crisis is not totally rely on locking down or putting up countrywide curfews, but early diagnosis. Move to the communities and diagnose the suspected people in the community so that it can be prevented getting infected and getting secondary peaks of dangerous COVID outbreaks in the community. So vigilant contact tracing and managing them, an effective and humane quarantine has to go together with the above mentioned. Let me briefly address the myth of quarantine clock. Unfortunately, because the WHO and other organizations said so that 14 days is a magic day and day 15 onwards no one can infect anybody else is fundamentally faulty. So people who are adhering to this faulty method are blindly going to release patient on the day 14th or 15th assuming that they are not infective anymore, which is again not true, and there are a lot of anecdotals now. People going home from quarantine centers are getting infected and also putting lives of other people at risk. Similarly, the people has a varying degree of immunities. People who have the lowest immunity will get the disease within 1 or 2 days, and they may not even survive. People with the moderate immunity will struggle and develop antibodies within few days, and that these patients can actually carry the infection way beyond day 14, although they may not be severely affected or and have a less death rate. People with the very strong immunity, on the other hand, may not even show any signs and symptoms. They may not even know that they have this particular dangerous infection. So they can also spread the disease during that incubation period, and that's another worrying sign. So the third category which I mentioned about the so strong immunity, they can overcome the virus threat because they have the multiple sets of inherent immunity, specifically work through vitamin D and other nutrients which have been strengthened in their immune system. So, depending on the decision made by the authorities, the clinical outcomes are going to be different in various countries. We already see that compared to this handful of Eastern countries versus the West. So, since the people may not develop the signs and symptoms, and some people might go beyond 14, it's essential that every person prior to discharge from quarantine centers and hospital need to be tested to be negative prior to discharge. If they're negative, that does not necessarily mean that that person doesn't carry the virus, because it may be too early testing. So these patients should be retested after 2 or 3 days later. Again, can be done, repeated again if necessary. Therefore, simply rely on the arbitrary 14-day deadline can be disastrous for any. The way to overcome is simple. Don't rely on this magic 14-day number, but test everybody prior to releasing from the quarantine centers. Because the number of days has gone by despite not having the clinical symptoms, does not mean that people are carrying the virus. Sometimes even the RT-PCR blood test may be negative, which can become positive in due course. The sensitivity and the specificity of this particular set of tests varies depending on the assay kits they are using. Not every kit is the same. Some are very sensitive, some are only have about partial sensitivity up to 60 to 70%. Not testing during prior to releasing from quarantine centers is really problematic and adding problem to the secondary outbreaks, expenses, more suffering, and prolongation of the epidemic. So, in summary, health department should not take any shortcuts to avoid future disasters. The next video I'm going to discuss more about the quarantine and the humane way to handle that and handle not. So until the video 6, thank you for participating. Bye.